Hello, today we will discuss about schizophrenia and other spectrum disorders. First of all, we will discuss what is schizophrenia. Schizophrenia is one of the most severe mental disorders. It involves disruptions in thought processes, perceptions, emotional responsiveness, and behavior. Its symptoms can include delusions, hallucinations, disorganized speech and behavior, and negative symptoms. Delusions are firmly held false beliefs, often paranoid in nature. Hallucinations, mostly common auditory, where the person hears voices that are not there. In the disorganized speech and behavior, making it difficult to communicate or perform daily tasks. When negative symptoms are present, like reduced emotional expression, lack of motivation, or withdrawal from social interactions. Dear all, these symptoms significantly impair a person's ability to function in everyday life. Schizophrenia is divided in three groups: positive symptoms group, negative symptoms group, and psychomotor symptoms group. In the positive symptoms, behaviors are experiences that are not typically present in healthy individuals. These includes delusions, hallucinations, disorganized thinking, and inappropriate emotional responses. When negative symptoms group, it involves the absence or reduction of normal functioning. For example, include poverty of speech, there would be a less speech, flat affect, low motivation, and social withdrawal. These symptoms often contribute more to disability than positive symptoms. When we see the third group, psychomotor symptoms group, such symptoms can include awkward or repetitive movements or slow responses. Some patients exhibit excessive movement or, in contrast, may become almost motionless. Note, it is important to remember that individuals experience a unique mix of these symptoms. Now we will discuss etiology of schizophrenia and psychotic disorders. Etiology means causes. The exact cause of schizophrenia is not fully understood up till now, but research points to a combination of biological, psychological, and social factors. What are these factors? Let me discuss one by one. One factor is involve genes. There are strong hereditary components. Individuals with a family history, especially identical twins, have a significantly higher risk. Coming towards the developmental and familial risks, complications during birth and early developmental issues may be linked with negative symptoms, while unstable family environments may relate more to positive symptoms of schizophrenia. On the third number, psychosocial stressors are important. Stress sensitivity is often heightened. Schizophrenia is more commonly diagnosed in urban, low-income settings. Family environments with high level of criticism or emotional over-involvement known as high expressed emotion, are linked to higher relapse rates. So, it is not just one factor, but a combination that contributes to the development of the disorder. After the etiology of schizophrenia, now we will discuss the diagnostic criteria. The diagnostic criteria for schizophrenia, as outlined in the DSM 5, Diagnostic Statistical Manual 5, involve several key components. Criteria A: two or more of the following symptoms must be present for a significant time during a 1 month period. These symptoms include delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. At least one must be delusions, hallucinations, or disorganized speech. When we see criteria B, there must be a marked decline in functioning in one or more major areas such as work, relationships, or self care. Criteria C: symptoms must persist for at least 6 months. But keep in mind, these symptoms must be active for at least 1 month. Criteria D: other mental health conditions such as mood disorders or substance induced psychosis must be ruled out. Dear all, accurate diagnosis is essential as many disorders can mimic the symptoms of schizophrenia. Next slide is about the disorders in schizophrenia spectrum. Keep in mind that modern psychiatry recognizes schizophrenia as a part of a broader spectrum of disorders. These disorders share some clinical features but differ in duration, severity, and specific symptoms. What are those disorders? Those disorders are schizophrenia, schizophreniform disorder, schizoaffective disorder, delusional disorder, brief psychotic disorder, substance medication induced psychotic disorder, psychotic disorder due to another medical condition, catatonic specifier, and lastly, catatonic disorder due to a medical condition. I will explain one by one briefly these disorders. Before describing the detail of those disorders, I would like to explain specifiers, course specifiers, and severity specifiers. Course specifiers describe how illness has progressed over time. When the first episode, the individual can face the acute symptoms, partial remission, full remission. Acute symptoms are the symptoms that are severe and sudden. Partial remission, symptoms remain but with the notable improvement. Full remission, no significant symptoms are present. When multiple episodes individual experience, it also categorized as acute, partial remission, and full remission. Here is important to understand continuous. When continuous ongoing symptoms without significant period of remission. When these are unspecified, used when there is not enough information to categorize the course. Moving toward the severity specifiers. This rates the current severity of disorder on a scale from 0 to 4. 0 is not present and 4 is present and sphere, based on 5 main symptoms. These 5 main symptoms are delusions, hallucinations, disorganized speech, abnormal psychomotor behavior, and negative symptoms. As I told you that schizophrenia is a part of a broader spectrum of related psychotic disorders. Each psychotic disorder overlap but distinct features. Here is a brief overview of each disorder and its key features. First one is schizophrenia. Schizophrenia lasts 6 months or more, with at least 1 month of active phase of symptoms like delusions, hallucinations, etc., along with functional impairment. Second type is schizophreniform disorder, similar to schizophrenia, but its duration is between 1 and 6 months. When we talk about its function, functional decline may not be present. Third is schizoaffective disorder. Schizoaffective disorder features both schizophrenia symptoms and major mood episodes. For example, depression or mania. Psychotic symptoms must occur for at least 2 weeks without mood symptoms. Number 4, delusional disorders. These disorders characterized by persistent, non-bizarre delusions like being followed or poisoned. These delusional disorders last 1 month without other schizophrenia symptoms. Number 5, brief psychotic disorder. Brief psychotic disorder, sudden onset of psychotic symptoms lasting less than 1 month, followed by full recovery. Number 6, substance medication induced psychotic disorder. Symptoms occur during or soon after substance intoxication or withdrawal. Number 7, psychotic disorder due to an other medical condition. There would be a direct result of a medical illness. Such type of medical illness like, for example, brain tumor, epilepsy, etc. Number 8, catatonia specifier. Catatonia specifier can be added to any mental disorder for catatonic features. For example, stupor, mutism, posturing, etc. Last is catatonic disorder due to an other medical condition. These are diagnosed separately when catatonia is clearly caused by a medical issue, not a psychiatric disorder. Important is that these distinctions are crucial because treatment and prognosis vary depending on the specific diagnosis of these disorders. Now we would discuss about the treatment of schizophrenia. For treatment of schizophrenia, not a single type of treatment is recommended. Some type of pharmacological treatment, psychosocial interventions, community support and rehabilitation, and hospitalizations if needed is also recommended. We will discuss one by one these type of treatments. When we say that medications are used, that medications may be antipsychotic, first generation and second generation medicines are recommended, clozapine, etc. And when we recommend the psychosocial treatment, in the psychosocial treatment, it is observed that cognitive behavior therapy is very useful to reduce the stress related like delusions and hallucinations, etc. Social skills trainings are also recommended that improve social functioning and communication of patients. Family therapy is also useful to reduce relapse by addressing high expressed emotions. Number third, community support and rehabilitation treatments are recommended. These treatments are helpful when therapists give psychoeducation to patients and families. These are helpful, particularly housing, vocational, and educational support. Sometimes hospitalization is needed when particularly acute psychotic episodes are present or when there is a danger to self or others harm. But it is important to note that early intervention programs are useful, better long term outcomes, and with early continuous care. I would conclude today's lecture on schizophrenia by understanding that schizophrenia and related disorders are complex and require careful diagnosis. It is important for the treatment that early intervention and appropriate treatment can lead to a better results. Thank you.